I was just having chronic pain. I was really having trouble just living a normal life. I have 4 kids. It was just really kind of hard to get through the day.
A neuroma is a painful tangle of nerves that often results from degenerative changes or trauma. What we usually see is a neuroma from surgery. So someone would have maybe a C-section or an appendectomy, and where the scar formed, they get entrapment of little sensory nerves, pain nerves in their tissue, and they become rapid scar tissue. And at the same time, the nerve is trying to heal and it sprouts and forms a little tangle. The pain from neuroma is both spontaneous, meaning it just occurs whenever you're walking around and you get this pain, or most commonly by direct pressure over the site. So this thing is exquisitely tender. You can see that people can put a finger on it and reproduce pain. It's very sharp and lancinating.
I had had hernia surgery about a year before. When they sewed up the incision, they sewed the nerve in with some scar tissue, and it just caused a lot of pain. It was just chronic pain and nothing, drugs didn't help. And I saw Dr. Rodrigue, and he just said, I really think we can help you, and he just went above and beyond to figure out what I needed.
Neuromas are hard to diagnose. They're not visible by X-ray, CT, or MRI. You don't see them. It's a clinical diagnosis. You get a history where there's chronic degenerative changes, maybe in a foot or hand joint, or there's been surgery at that point, and right along the surgical line, you'll find a point that's exquisitely tender, and by clinical suspicion, you know this is a neuroma. We see those, we can target them for injection of these neurolytics, which kill the nerve tissue and eliminate the pain. So we injected it first and blocked the neuroma and proved that we indeed did have the right site and we could block it. Then we followed with the neurolytic, and it gave her tremendous relief of that nerve entrapment.
I felt relief very quickly after the injections. They were a little bit sore, but I felt better immediately. I now can exercise again, and I can live an active life and a normal life. Dr. Rodrigue and his staff were fantastic.